Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Retromammary breast abscess. Breast abscess. Retromammary breast abscess is actually an extension of breast abscess. It is an extension of empyema thoracis and also osteomyelitis of ribs. So, retromammary breast abscess is an extension of, it can be an extension from the breast abscess. So, that means there can be a breast abscess may be present before, and this breast abscess which is present in the breast, it might go into the retromammary space and it can result in retromammary abscess, or it can be from the chest wall. Empyema thoracis can result in retromammary abscess, or it can be from the osteomyelitis of the ribs. So whatever the cause is, this retromammary abscess can be seen. So for the retromammary abscess, only the conservative treatment is essential. There is no need to drain the abscess in case of retromammary abscess.
thank you and thank you for watching.